MS as far as stem cell research there?
Okay, so first thing, the National MS Society would like you to know, because I just sat on the committee that kind of voted on this and they're preparing their webpage, that the overseas advertising for stem cell stuff to go do now we're very leery of, okay, for lack of a better word. We're willing to call it quackery because it has great potential, but we certainly think it's not ready for prime time. So where stem cells have been looked at historically, okay, and there are studies going on in North America, where you take somebody who's in that secondary degenerative phase where nothing has helped them, and what you can do with their bone marrow stem cells, because MS is ultimately a disease of the immune system, is you take out their stem cells, you wipe out their bone marrow like you would do in a cancer patient who's going to undergo stem cell replacement, and you give them back their own stem cells. And the hope is that since you're starting from sort of a more immature state, that if you kind of wipe out the immune system, which is where the MS resides, and the process starts over, we don't think you're born with MS. You got MS at some point of your life due to, we think, getting the wrong virus at the wrong time with the wrong basic immune system, so that maybe you can kind of reset the system, okay? So that is sort of like the traditional approach. Now, people are looking at a more aggressive approach. So just like typically Novantrone is used as a last-ditch drug, in England they've been studying that as a first-line drug. You have MS, you hit it hard. You make them as sick as possible for a few months early on, and then you start off with drugs like Copaxone. In fact, the standard protocol that's being tested in England is give Novantrone, I think, for 3 months, and then you just put them all on Copaxone. And they claim great results. Of course, all this, I should mention, off-label at this point, okay? So the concept would be, why wait till they're really not doing well? Take everybody who's healthy, wipe out all their bone marrow, and give it back. The problem is, okay, number one is that's not proven yet. Okay, you need to follow people for a number of years. And there is some mortality, actually, not just morbidity, but some mortality still with stem cell, autologous stem cells being done, at least in places like the Texas Medical Center. So I suspect those guys know what they're doing. On the upside, young people with relapsing, remitting MS are typically very healthy. So at least what kills off some people with stem cell transplant when it's autologous stem cell is their body just can't take the stress of the stem cell transplant process. And you'll have an older person with some sort of cancer and they'll have a heart attack and die. So at least that should be less likely to happen. But the problem that we've seen in trials with immunosuppressive therapies, meaning therapies to adjust the immune system, is sometimes things come back in a way that you don't want them to. So the exact drug escapes my mind, as someone may remember in the audience, but you wipe out their immune system, and the first part that came back, and at least in a couple patients, was antibody to their platelets. Wiped out their platelets, and somebody died in the trial. You can't live without platelets because then you get a bleed, okay? Or there's other autoimmune, or there's other trials where they've given people Graves' disease, which is an autoimmune process against the thyroid. So when you wipe out the immune system and attempt to reset it, sometimes things don't, again, because you're growing up the immune system overnight almost, sometimes things don't go the way it's planned. Okay, and so therefore this is one of those things that need careful controlled trials, and they need it for years. Now, it's very doable. It's the kind of trial that could be done, You take people with newly confirmed MS, half go on, we'll say Copaxone, since they're nice enough to sponsor our meal today, or our talk today. The other half go and get this radical therapy. You wait 5 to 10 years and you see what all is going on. So I would say it has great promise. But the whole term use of the word stem cell has kind of entered into our non-medical debate these days because of politics. And so you have people proposing that, stem cells are going to cure everything and everybody, and we're far from that point at this point. So I think it holds promise. I don't think it's there yet, and I certainly would not encourage any of my patients today to fly to go get it, and apparently you can.
If you were on an interferon drug, for this treatment?
I don't know. No, I don't know the specifics that they're using for screening. I don't understand why you wouldn't be. Okay.
I got the idea that say your interferon drugs are deteriorating your stem cells or such as they are.
No, we don't think that's true.
Don't
Okay.
listen to me.
No. So just so you know, I mean, I can see that they may want you off those meds for a period of time before you,
like Copaxone.
before you got it.
Yeah.
Okay, but none of the drugs we have on the market today would go far enough to alter the actual stem cells. So that's sort of not an issue of today. That may be an issue of some of the oral therapies that are coming down the pipe that actually work much earlier than the drugs we have now in the immune chain. But not the ones, but we just think it's not ready for prime time and hasn't been proven.
Did you see the article in Friday, January 30th Chronicle about MS and stem cells and the study that had been done?
No, I didn't see the article, but the problem with MS studies in general that are, quote, open label, okay, in that there is the placebo effect. There is the natural history of the disease with varies widely, and I'll give you one example where we've kind of proven how things could go wrong. So if you take somebody who has optic neuritis, you want to know how are they going to be in a year, the answer is 97% are going to be fine. Okay, so you can imagine if you take patients who are newly diagnosed with MS, they're at an acute relapse early on, so it's their first relapse in their life or their second one. Most of those at the end of the year are going to be just fine, whether you intervene or not. Okay, so therefore, it wouldn't surprise me if you took 30 people with very early MS and found they were all better a year later from when you started, that would not be a surprise. Because when you enroll patients in a study, you enroll them because something's happening to them. Okay? Generally, people don't show up for studies when they have inactive MS. They show up in the doctor's office because they had an attack or something happened, and the doctor says, by the way, I'm doing this study. You're a candidate for it. Would you like to be in it? So I do think there's this natural bias of how you take people into studies. And certainly I do a lot more migraine than MS, where we see a lot of this. So you take people into studies who are having frequent migraine, well, they're showing up because they're having frequent migraine. They're on the sinusoidal curve all by themselves. And so you put people on placebo, they get 30% better. Okay. So, I mean, so I do think that's the thing. Now, when you see early data like that, then I think, yeah, it screams out for a good study. And certainly, no one can argue with putting something in the Lancet. The Lancet accepts something, for those who don't know the Lancet is sort of the New England Journal of Medicine for Europe. Okay? So if the Lancet has it, then by all means, it ought to be studied further. But the road is littered with early studies that look great and follow-up studies that were blinded that went nowhere. Could be this drug still works and the studies were poorly made. It's always hard to know. Dr. Walensky, just sort of, he's from the UT Center for those who don't know him, presented to a group of doctors and basically lined up all the studies of how frequent people's relapses, and pointed out that in the last 10 years, the relapse rate of the placebo groups have gone way down. And that the percent of women in these studies has gone up, the percent of women, of MS patients who are women have gone up, and is arguing that the disease has changed. Something about the epidemiology of the disease has changed in the last decade from the decades before, versus, no, if you get a really sick patient, you don't put them in studies, you put them on therapy, and therefore it's not. And he points out, well, that would be true for the US, but in patients in Russia, they also are not as frequent relapsers as we found in our studies in the 80s. So that may be something about the diseases changing. So until you do the randomized control trials, a lot of things can go wrong and can lead you astray. So again, I hold out great hope for all sorts of stem cell stuff, but we're not there yet.